This conference will now be recorded.
The topic of today's discussion is drugs used in erectile dysfunction. The contents of this topic will be an overview of what is erectile dysfunction, the drugs used in erectile dysfunction, mechanism of action of these drugs, and structure and examples of the drugs that we shall be mentioning as per our syllabus. So this erectile dysfunction is a condition which is a result either of a neurogenic, hormonal, or a vascular disorder. It is usually an inability in the male to attain a satisfactory sexual relationship due to either lack of erection or the problems with release or ejaculation or both. Premature ejaculation refers to an uncontrolled ejaculation before or shortly after the prescribed time, and retarded ejaculation is usually synonymous to it. There is also something called as retrograde ejaculation, which denotes the backflow of the semen. Usually, nitric oxide plays a significant role in erectile functioning of the penis. During the sexual stimulation, nitric oxide is released from the nerve endings and the endothelial cells into the corpus cavernosum, that is the erectile tissue present. This released nitric oxide enhances the blood flow and causes erection. However, neurogenic diseases like diabetes, spinal cord injury, polyneuropathy, multiple sclerosis, alcohol abuse, Parkinsonism, radical pelvic surgery, or neurological disorders like damage to the spinal cord, autonomic neuropathy, peripheral neuropathy, cerebrovascular accident, endocrine disorders like hyperthyroidism, hypothyroidism, hypogonadism, diabetes mellitus can be some of the causes or reasons why a patient could suffer from what is called as erectile dysfunction. Mostly, the drugs used in the treatment of erectile dysfunction are called as PDE5 inhibitors, and these are the most common examples of PDE5 inhibitors. Sildenafil, acetyldenafil, tadalafil, vardenafil are some of the drugs. We know sildenafil very famously as Viagra. Now, what exactly do these PDE5 inhibitors do? So you see on your screen the mechanism of action of the drugs used in erectile dysfunction. A patient suffering from erectile dysfunction either may produce insufficient nitric oxide, because of which there is insufficient amount of cyclic GMP present, and over the course there is low breakdown or no breakdown of the PDE5 enzyme, which is responsible for attainment of the erection. This enzyme PDE5, or what is actually known as phosphodiesterase enzyme, is mainly found in the genital area of the male, and it hydrolyzes the cyclic GMP to the inactive form GMP. Drugs which are PDE inhibitors like sildenafil citrate bind to the active site of the PDE enzyme, thus preventing its mechanism via hydrolyzing cyclic GMP PDE inhibitors. These PDE inhibitors are selective and orally active inhibitors which facilitate erection in response to sexual stimulation and enhance the nitric oxide induced relaxation of the corpus cavernosal smooth muscles. The flow chart on the screen is an explanation as to what exactly happens during the mechanism of action of sildenafil citrate, which is a erectile dysfunction drug, a PDE5 inhibitor. As per the syllabus, these are the two drugs which are prescribed, that is sildenafil citrate and tadalafil. Sildenafil citrate elevates the levels of the second messenger cyclic GMP by inhibiting its breakdown via phosphodiesterase type 5. It is clinically used in the management of erectile dysfunction. It is used as a vasodilator and is often used to reduce symptoms in patients with pulmonary arterial hypertension. Tadalafil is also a selective inhibitor of PDE5 and has several times more affinity towards PDE5 than sildenafil citrate. It is also used in the management of erectile dysfunction. It has minimal or no effect on visual disturbance and has an extended half-life of approximately 17.5 to 18 hours relative to sildenafil. Some questions for assignment under this topic. What is erectile dysfunction and what are its causes? What do you mean by PDE5? Draw the structure and example of phosphodiesterase inhibitors, sildenafil citrate and tadalafil. Explain the physiological mechanism behind erectile dysfunction and how are PDE5 inhibitor drugs useful in treating the same. Explain sildenafil citrate structure, its IUPAC name, its mechanism of action, and its clinical use.